Hi, everybody. I'm Paul Kagabine with the Garland County Library in Hot Springs, and we're here again this evening with Dr. Jean Shelby, the Garland County Health Officer. Today is December 10th, and Dr. Shelby's here again to give a report on the status of the COVID-19 pandemic in our area and answer any questions you and I have for him. So welcome back, Dr. Shelby.
Nice to be here with you.
So this is the final COVID update from Dr. Shelby for 2020, but we're going to be back to give you the first one for 2021 on January 7th. The cases are currently higher than they've ever been, and we've got a lot to talk about tonight concerning that and the vaccine. So I'll let Dr. Shelby go ahead and start with his usual progress update, and after that, we'll return to answer any questions.
Okay, thank you, Paul. I want to kind of maybe summarize some of the things that we've been doing here in Garland County. I'm a member of the Garland County Task Force on the coronavirus that was formed in early part of March with community leaders, political leaders, the county judge Mahoney, Bill Burrows, the city manager, and then have representatives from the Garland County Health Unit. Susan Lester represent what all is going on there, which is a lot. And then we have representatives from both of the hospitals. We have representatives from law enforcement, and we've over the time we've added new members of our task force as it's been called for because of the developing pandemic in Garland County. We have members representing the nursing home group. We've got some business leaders, Gary Troutman with the Chamber, Steve Harrison with Visit Hot Springs, and so and then Bo Robertson, who's our head of the Office of Emergency Management here in Garland County, who plays a big role in our response to the pandemic. So we meet and on Monday morning on a Zoom call, and we have been, like I say, since March, and really kind of address the issues of what's going on in Garland County and kind of brainstorm and see what we can do to kind of manage the pandemic, because as many people know, I mean, we were fortunate early in March and April not having much of an impact in Garland County, but that has certainly changed over the past several months. As I've mentioned before at these meetings, we've kind of watched the development of the infection in Garland County, and it was slow at first, but we've started seeing peaks really in July. And I think the pivotal time was the Memorial Day weekend. We saw a definite jump in our new cases and active cases, and we subsequently saw a really big peak after the 4th of July. A little bit lesser peak after Labor Day weekend, but we've really accelerated from there. Our biggest peak prior to this week was really after Halloween. I'm not sure whether Halloween was the cause, but we saw a significant increase in our cases the week or two after that. But we're now in a whole different phase of the pandemic here in Garland County. I think everybody was concerned and worried about what was going to happen over Thanksgiving, and I think our numbers certainly over just this week have kind of given us the answer of what's happened. Normally, when I make my presentations to the task force, I use weekly numbers, not the daily numbers, because there's a lot of fluctuation in the daily numbers. But for the presentation on Monday, we were seeing from the previous week we'd seen 325 new cases, and we are testing over the last really few months. We've been averaging between 2,000 and 2,500 tests being done in the county. So our positivity rate at that time was 12.8%. We had active cases had been fairly steady over the last few weeks, and we had like 412 this past Monday. One of the things that we've watched closely, because it shows how devastating this infection is our deaths, and the prior week, we had 8 new deaths recorded, giving us a total of 112, which is our death rate in Garland County is significantly higher than the state, possibly reflecting our older population. But as far as our rates, just in the first 4 days of this week, we've seen really dramatic increases. Just since Sunday, we've added another. We've had an increase of 124 active cases to what we've had, and we've had 255 new positive cases just in the past 4 days. Works out to 63 new cases per day, which is much higher than we've ever had before. We had peaked about a month ago. We'd had 53 average cases, new cases a day back then. Before it had dropped down some, but we're definitely on a significant upward trend. Also, one of the things that's really concerning is that we've already recorded 8 new deaths in the county since Sunday. That's 2 deaths per day, and that's just a hard thing to accept that is happening here in our community. There are some kind of I think some kind of improvement that we've seen over the last few weeks. A month ago, we were having some severe outbreaks in some of the nursing homes here in Garland County. They really stepped up and really isolated and really doing really significant testing. And so the 3 nursing homes that had significant numbers of positives and a significant number of deaths have got it under control, and we're seeing much fewer cases in our nursing homes. We've got one nursing home that had not been affected, but that has started to have some. But I think that they're going to be on top of that, and hopefully we'll limit that. We've been monitoring the rate of cases in our Hispanic community, and unfortunately, it's been pretty flat, and we haven't seen the uptick that a lot of communities have seen within the Hispanic communities. One thing that is also I think positive is that I follow the percentage of our cases by age groups, because the virus really affects different age groups differently. And one of the real disturbing things that was happening 6 or 8 weeks ago is that our percentage of cases within the greater than 65-year-old was very high. It was probably one of the highest rates of any county in the state. Of our positive cases, we were seeing almost up to 50% of those within the over 65, and I think subsequently that's when we started seeing the really marked increase in the number of deaths. But over the last really 3 weeks, we've seen a significant reduction in that group. Like I say, it was up around 50%, and now it's down to about 20% of our population, or of our positives, which is more in line with the statewide average, and certainly I think will bode well as far as our fatality rate going forward. The other age group that we look at closely is the 0 to 17, to try to kind of see what's going on in that age group, and because it affects the schools so greatly. And and I think all of the school districts in Garland County have done an excellent job in really following all the guidelines and protocols, even if it's been difficult on them. And so the number and the percentage of our cases in the 0 to 17 has stayed really steady over the last 5 or 6 weeks. We've added about 15% of the total, and the actual absolute numbers around 55. And the school superintendents are on our call, and I think they uniformly have done a very good job. And the positive cases that they've had have not been attributable to the school. It's from exposure outside of school, exposure at home, and that's where the positive cases in our schools have come from. And again, with doing the very good contact tracing and instituting quarantine, they've been able to really maintain a good safe environment in our schools. One other thing that we talked about at our meeting, because it is something that came out as a directive from the CDC last week and was adopted by the Arkansas Department of Health, was some alternatives for the recommendations on quarantine. Quarantine is instituted in people that have been in close contact with someone who is positive for the COVID-19 virus. And with more study, the CDC was able to relax these somewhat. The guidelines had been for the past several months is that if you were a close contact of someone that tested positive, the standard was to quarantine for 14 days to ensure that if you contracted the virus, that you would not be spreading it to other people. That what the CDC has done they've reduced that length of time, though they still recommend the 14 days if at all possible, because that is the safest. Almost 0% of transmission from a close contact if you quarantine for the 14 days. What they have done, though, is that if you quarantine for 10 days, and this is just people that are not positive or not infected, but this quarantine is for close contacts only. And if the person that is quarantined is asymptomatic for 10 days, the risk of them transmitting the disease is very low. It's there, but it's considered an acceptable rate so that people can come out of quarantine on the 11th day. Another way of dealing with being in quarantine that has also been studied and it is effective. It's not as effective as the 14-day quarantine, but again, it's considered an acceptable risk. And what you can do is after the 5th day, the person can be tested either with the PCR test or the antigen test. And if they are negative, if one of the tests is negative, the person can come out of quarantine on day 8. So one of the issues that we were seeing, especially in the schools, we didn't really have that many cases, but there were a lot of close contacts, and so the extended quarantine was really affecting their effectiveness, because so many of the staff and teachers were having to quarantine, and also we've seen the numbers of quarantine in some of our city services, some of the departments in the city of Hot Springs, as well as within some of our law enforcement, have had a number of people had to be quarantined, and that really caused a lot of disruption in their procedures. But it's really important to understand that this is just for contacts, and it does not apply to people that have COVID. The requirements for people that do test positive have remained unchanged, in that someone that it does test positive, they have to isolate, and isolate is more confining than quarantine. And they need to, if they're asymptomatic, they need to isolate for 10 days from the time that they were tested positive. If they develop symptoms or continue to have symptoms, then they need to extend their time of isolation, kind of based upon the symptoms that they have and the severity of them. So those are some important developments. I'd like to talk a little bit about the vaccine. I think we're all very excited about the progress. Just coming up here, I think the FDA has given an emergency approval, and certainly things have been being set up for distribution and administering the vaccine over the last several months, but it's been more noticeable over the last few days, because I really feel like it's vaccinations in the United States are going to be happening very, very soon. And I think that as far as how it's going to roll out here in Garland County, there's a lot of, at our meeting, there was uncertainty exactly how it was going to be happening. Bo Robertson with the Office of Emergency Management is kind of heading that up and in direct contact with people at the state level, because there will be vaccine coming into Garland County probably within a week. And they were still working out the details. The early vaccines are going to be primarily for frontline healthcare workers, people that work in the hospital and work with the COVID-19 patients, and then certainly, excuse me, in the nursing home, as well as vaccination for the residents of the nursing home, since they are definitely considered the most vulnerable people. As far as the amount of vaccine, I don't think that we'll have enough to really cover those two groups. Certainly not this week or our first rollout, but I think that as the production ramps up, that we will be seeing more vaccine coming into Garland County. There's the development of the vaccine is really been pretty amazing. I went to medical school a long time ago, and the way that this vaccine is from any previous vaccine is pretty remarkable, and just the speed with which it was developed, and even the techniques that they're doing with this vaccine. Are just, it's really exciting that this could happen so rapidly. And of course, there are people, scientists all over the world that have been working on this since January. And to me, it's pretty amazing that in the early cases in China, they were actually able to decode the genome of the COVID-19 virus within really a few weeks, and we're able to get that information to scientists all over the world. And so the process of developing a vaccine was very soon after the discovery of the virus. And there are two main vaccines that we will probably be seeing over the next few weeks. I think the Pfizer vaccine is maybe a little bit ahead in the process than the Moderna vaccine, though I think it's pretty close also. And there's going to be some issues, but the development of the vaccine and the testing of it has been very rigorous, and I think everyone really emphasized that, because we wanted to make sure that the vaccine that it does come on the scene is number one, is safe. It's not going to cause severe problems, and then the being effective. That's also going to be real key. So there's a lot of different things we could talk about the vaccine. I'm sure we'll talk about them as the program goes on, but I think I'll turn it back to Paul and see which direction we want to go.
Oops, can you see me? Thank you, Dr. Shelby. As usual, I had a long list of questions, and you kind of cut it down in half there with a lot of the things you already said. Before we get into questions, I would like to point out that apparently Governor Asa Hutchinson is going live at 7 p.m. That's probably about the time we'll be ending here. He's going live on PBS. I wasn't able to find out specifically what he was discussing tonight, but some of our viewers might be interested in tuning into that. Do you happen to know what he might be discussing this evening?
I think a big part of it's going to be the rollout of the vaccine. I think the timing of that, and that's going to be a big thing, but also kind of addressing the total upspike that we're seeing in the state of Arkansas. I think we were fearful of what was going to happen over Thanksgiving, and I think our fears were realized in the number of cases that we're seeing on a daily basis and the number of deaths. And then in the also a big concern is the hospitals that may be reaching some capacity, and worry about the staffing of the hospitals. So it doesn't bode well, because you see the big increase in the number of cases. Usually it's a couple of weeks down the road that we see the increased number of people with severe disease, and in some parts of the state and in some hospitals are reaching close to capacity. So I think he's going to be addressing what the state's going to be doing in terms of that, as well as any further measures we can do to try to slow down this deadly virus. And we were worried about Thanksgiving, and Christmas and New Year's are just around the corner. And unfortunately, with epidemic or pandemic like this, things don't just go on a steady upstream. They start doubling and tripling, and so some of the projections are pretty grim. Even in Arkansas, looking at thousands of more deaths before it actually peaks, which I think the University of Arkansas is predicting the peak not to occur until about April. And we've seen which is a strong uptick, and if we have to wait till April before we're going to start seeing a downtick, that's real frightening. And I'm sure the governor's going to address that tonight too.
And how are our local hospitals doing on capacity?
At our meeting on Monday, they seem to be doing well. Their numbers of cases was pretty steady, and their staffing was good. So they did not express any new big concern. I think they're looking at the projections and certainly developing contingency plans to deal with the situation if we do have a big influx. But I think right now things seems to be in pretty good shape.
You mentioned in your opening that you're not exactly sure what dosage or amount of vaccine that we'll get here in this first amount, and that it may not be enough to cover all of the healthcare workers and nursing home residents. Do you have an approximate number of how many residents and healthcare workers we have in the county, and how long it would take to get all of those groups vaccinated?
No, I don't have any specific numbers on that. I think the number that I've heard for the state is that we're going to get 25,000 doses initially, and I think as far as the numbers of frontline healthcare workers and nursing home residents and staff is significantly higher than the 25,000, and I think they're expecting, and I haven't seen anything definitive on that they're going to expecting kind of weekly allocations of the vaccine, and certainly they hope that those allocations increase in number, but I haven't seen it, and I don't know that those numbers are readily available at this point.
Since even among those groups, the healthcare workers and the nursing home residents, since they can't get it all immediately, how is it determined who's priority among those groups? That's been in flux, because I think that the governor's press conference on Tuesday, that issue came up, and I don't think there was a definitive answer. I think that they are depending on the counties to kind of figure that out, which I think is a good thing, because each community and county are different, and
and I think it's pretty unpredictable how how people are going to respond to this, especially since it's not going to be that widely available initially.
So the federal government made a deal with Walgreens and CVS to distribute the vaccines once they're approved by the FDA. Are they the ones distributing to our local nursing homes?
No. I think at least initially, the vaccines are going to be distributed to the major hospitals because the vaccine. One thing about the vaccine is it's very delicate, and it's going to require major efforts to transport and keep this vaccine. And I think there's more likelihood that a major hospital pharmacy is used to dealing with sensitive and specific, kind of even unusual type of medication. So I think that it's at least initially going to be kind of managed by the local hospitals, but I'm sure they have distribution roles set up and as to how to get this to the actual people. So I might be wrong, but I don't think that at least initially it's going to be the local pharmacies that are going to be the repositories of the vaccine.
So the United Kingdom, of course, started vaccinations this week, and health officials in England advised people with a significant history of allergic reactions not to have the Pfizer vaccine after 2 healthcare workers received the jab and suffered allergic reactions. Do you have any advice for Arkansans with a history of allergic reactions?
Well, yeah, I think I'd be real cautious, especially it's a new vaccine. The testing of it was really pretty remarkable. I mean, they tested it like new vaccines would normally be tested, but I think that the time was compressed in order to get it out. I know the phase 3 trial of the Pfizer vaccine, they had 40,000 people that were involved in that from several different countries, and I think that they were able to establish that the vaccine was safe and effective. But it's a big difference between looking at 40,000 reactions or non-reactions to the vaccine and up into the millions, because even a very rare reaction will become much more apparent if you have the bigger numbers.
On that note, Michelle in the audience asked, since the Pfizer vaccine is not recommended for people with allergies, will that apply to the Moderna vaccine also?
I haven't heard anything about it, about severe reactions in their trials. I think that they will probably be more cautious since they have had the 2 major reactions, and they'll probably try to get a better sense of what kind of allergies might be cross-reacting with this, that it didn't show up in the phase 3 trials that they did.
What are some of the common side effects in general people might expect to get from the vaccine?
Well, that's one of the things that I think it's going to be real important to make sure that people are educated about the reactions of this vaccine. This vaccine it's a whole new method of manufacturing it, and it's called a messenger RNA, which the companies make, and it stimulates your immune system so that when you are exposed to the actual COVID-19 virus, you've got your immune system is ready for it. But you're still injecting a foreign substance in the vaccine, and I think that people are going to need to expect to have some soreness at the injection site. And I think there's a significant number of people that really aren't just going to feel great that day, that they're going to have some muscle aches and And I think that that's something that we'll have to get past, because some of these early side effects are similar to some of the early symptoms of the COVID virus. So I think it's going to be so important to make sure that people understand that there is absolutely no way that you can get a COVID infection from the vaccine. It's just not possible at all, because you're not even getting the virus. You're getting a portion. You're getting an RNA fragment that stimulates your cells to develop an immune response. So there's no way you can get it. But I think a significant number of people are going to have these mild symptoms. These symptoms of the reactions usually go away within 24 hours. But you're not going to feel good. And one of the things I was reading this week is that, that both of them are a 2 vaccine protocol. One encouraging things is that even after the first dose, people get a pretty significant amount of protection from it. But it's like in the 50 or 60% range of effectiveness with one dose. And with the second dose, it's when we get up to the 90-95% effectiveness. But unfortunately, the reaction from the second dose tend to be more severe in terms of the soreness, the body aches, and even maybe even a little low-grade fever. I saw one recommendation for people that are getting their second dose is just plan on taking a day off at work, because you're probably not going to feel too good. And so I think we definitely need to get the word out that these reactions these type of reactions are common. They're short-lived. They're not severe, but they're real in terms of not making you feel good.
What will our public health officials do to educate the public about the importance and the safety of the vaccine side effects?
I think I'm sure they're going to have some, public service announcements. If potentially once we start doing the vaccines, you may get, special reports from certainly the medical community, but also from, government leaders. I think that some government leaders are countywide, statewide, and in a country are going to step forward and get the vaccine, and maybe be able to explain that they're expecting to have some negative reactions, but they're confident enough that it's worth it to go ahead and get the vaccine when it's your turn.
You mentioned earlier that you were very impressed about how fast this vaccine has been developed, but of course a lot of people are going to be concerned that it was rushed with how quickly it came out. Is that a valid concern at all?
No, I don't really think so. I mean, it was just been highly scrutinized as a process that has gone forward with the development and testing of it, and the scientists that approved it today, we're looking at a lot of the little details involved in a trial reaction. Probably as far as anything negative about that, sometimes with a normal procedure with a new medication, is that you have a little bit longer time frame to see if there is lesser reactions or less common reactions, and have that information. But I think one thing that's going to be reassuring is that just the fact that the vaccine has been approved and is going to be widely used, the developers of the vaccine will be still watching very closely, not only the initial 40,000 people that received the vaccine, and will have a longer period of time to evaluate them, but there will be all kinds of ways of people that do have significant reactions or unusual reactions, that information will contribute to the ongoing evaluation of the vaccine.
What % of the population needs to get the vaccine for it to really have an effective impact?
Well, I don't know that it's really well known with everything being new here. I mean, this is certainly a highly contagious virus that we're dealing with, and the numbers I've heard is in the range of 70%, 60 to 70%. I think vaccines that have been studied much longer, such as the measles vaccine, and measles is a even much more contagious disease than COVID-19, and that I feel like that it's pretty well established that you really need to have a 90% of the population immunized to prevent outbreaks of measles. I don't think that we'll need to get to the 90%, but I think it's going to be a significant percent that in order to really kind of stop this virus completely.
If you had to estimate about how long would you think it would take to get 70% of the population vaccinated?
Well, I think there's a lot of variables, and some of it's going to be, the production of it, how fast that's being able to be done. The distribution, again, there'll be some challenges with the distribution, though I think that's been really worked on and perfected. I think initially that they've got to have a good plan as more in numbers increase. The plans will have to be different to deal with the large number of people involved. And I think another unknown that's been concerning to me for a long time is the number of people that will refuse the vaccine. And fortunately, over the last 15, 20 years, there have been a lot of sentiment, anti-vaccine sentiment in the population, and not just against this vaccine, against vaccines in general. And I think there have been different studies done on people that are willing and want to take the COVID-19 vaccine, and I think it's in the 50 or 60% range. So there's I think the ongoing education of the vaccine, what you can expect from it, and the real benefits to it, just not to you as an individual, but to a community. I mean, we can't forget about how deadly this virus is. It's like 300,000 Americans have died from it, and over 3,000 Arkansans, and how in putting it in perspective with the flu. We've had 6 people die of the flu in Arkansas this year. We've had 3,000 people die of COVID. So I think that things like that really show how serious this is and how important, if we want to really get this stopped, the vaccine is going to be a vital part of that.
Sadly, there's still people that say it's no worse than the flu.
Yeah, and there are a lot of people I could talk to that would disagree with them on that.
Got a couple of audience questions, good ones from Patsy. First, she asks, will the COVID vaccine be a yearly vaccine like the flu vaccine, or is there not enough data yet to know that?
There's really not enough data, because they really don't know how long it will be good for. I think that the early things, it looks like people that get the vaccine have a robust response to it, have antibodies, and then have ongoing antibodies, and also part of the way a vaccine can work is that even if your antibody levels go down, some of the immune response cells in the body have kind of a memory, and if they're exposed to the virus even later on, that it can mount a response to it. So I think it's totally amazing that this virus was not known a year ago, and what we know about it now, and I think that's a real tribute to where we come in terms of our understanding of viruses and the science behind viruses and vaccines.
Patsy also asks, will people have a choice on which vaccine they will receive?
I haven't heard any discussion along those lines. I think that, at least from the trials, they've shown pretty much equal effectiveness as they're in more widespread distribution. We might see some changes there, or the reaction profile, but I think that they're pretty much the same. I know that Dr. Romero mentioned this week that the question came up is that if you get the Pfizer vaccine for your first, can you get the Moderna for your second? And apparently the guidelines are pretty strict on that. That if you have to get your second vaccine, it has to be from the same manufacturer as your first.
Should people who have already tested positive for COVID still get the vaccine?
I think that, I think that that's the recommendation, because I think that it's just, with this being a new vaccine or a new virus, don't really know how long the immunity that you have from having gotten the virus is. So I think the recommendation is that the people that, even the people that had the COVID should get the vaccine.
What might happen if someone's currently infected with COVID and doesn't realize it and gets vaccinated?
I don't think there'd be any really adverse side effects or anything. It might be kind of confusing if you actually had an infection of the COVID-19 and you got your vaccination. And I think probably the unfortunate thing is that the people might blame the symptoms they're having on the vaccine, when they should be blaming the virus.
I got an audience question from Melody about the effectiveness. Those that were part of the double-blind study that have contracted COVID since the vaccine was given, well over a month after receiving it, received either vaccine or placebo. Do we have an update from Pfizer or Moderna stating if the vaccine or placebo was given to those that contracted COVID afterwards?
And I'm not aware of it. I was looking at some of the kind of details of the study, and I thought it was real interesting. Of the 40,000 people that were in the trial, half were placebo and half were the vaccine. I think there were like about 120 people in that whole group that subsequently developed COVID, and of that 120, I think 116 were in the placebo group and 4 were in the vaccine group, which is pretty strong evidence of the effectiveness of the vaccine.
Once someone does get vaccinated, is it still important that they continue to wear a mask?
Yes, definitely. Yeah, we would. I think that's one thing that people are concerned about, is you get the vaccine and say, well, we don't have to do all this other stuff. But that's not the case at all. I think it's going to be real important for people to continue wearing masks. For a variety of reasons. Certainly, the trying to prevent any spread of the COVID virus, but I think there's a lot of hope that by people wearing masks, that we're going to see fewer people with colds and fewer people with flu, and because that's still a dilemma, that someone that has the flu, and initially that the symptoms are pretty much the same as COVID. So anything we can do to eliminate the other respiratory infections, that's a good thing.
So speaking of the flu, how is our flu season going so far?
Well, I think it's been milder, but it's still early, because a lot of times the flu really doesn't peak in Arkansas until until into January, so sometime mid-January, and I know I can remember years when we really didn't see any flu at all until Christmas, when everybody gets together and spreads their germs. So I think it's really too early to make a judgment on that at this point.
I remember you did answer me in a previous discussion that you can have both COVID and the flu at the same time. So
yes, you can.
I don't think that's something anyone would want. So again, if anyone in the audience has any questions related to the vaccine or anything COVID related, don't hesitate to ask while you still have a chance. I'm going to move on to a few other general questions while the viewers get a chance to ask some. There was a study published in the journal Nature Communications yesterday, and it suggested that even though there's no significant difference in the proportion of men versus women testing positive, men have almost 3 times the odds of requiring intensive treatment and higher odds of death. Why is the virus more dangerous for men?
I don't have a definite answer for that. I would suspect it's probably they have a higher instance of comorbidity, more COPD, and more heart disease. I think generally that's the case, and I would suspect that they have more severe disease because of that. Another possibility could be that men don't go to the doctor as quickly as women do, so that they get sicker before they seek medical care. That might be one factor.
There's also been several reports throughout the pandemic how it's been more disproportionately harmful to communities of color, with Black men in particular having an especially high mortality rate. Why is that, and is there anything being done locally to support these groups?
Oh, from what I understand, a lot of it is just a lack of access to health care, as for people, people of color, people lower socioeconomic. But I think that's true for a lot of things, and this is just another one of those instances. And I think that maybe COVID is kind of bringing out that fact, and hopefully that we as a society can address that. Also, I think some of it probably has to do to the underlying conditions. There's definitely a higher instance of hypertension, diabetes, and heart disease in these groups, and they're certainly more at risk of having severe disease, and also the lower social economic people will tend to have less opportunity to isolate and quarantine, so you're more likely to see higher numbers within a family or group situation than we would with people that are more affluent and have the ability to have good medical care, and also the ability to follow the isolation and quarantine guidelines.
And you did mention earlier that the Latino community in our area was another group that was struggling. Is there anything specific that we're doing to tackle that issue?
Yeah, we noticed it early on, because back in probably May, we've gotten up to almost 15 or 16% of our cases were for people with Hispanic names. That's the only way we can really identify that from our database, and that's certainly much higher than the percentage of Hispanic in our community, and I think that's one of the areas where our task force really helped out a lot when we identified that was an issue, and Gary Troutman was very instrumental in bringing in people from the Hispanic business community to really work with us to make sure that we were getting information out, and so there was concerted effort by a lot of people, including our local health unit, the Hispanic leaders, and in the community, and Hispanic people that are in healthcare, and they were really they were going out to Mexican restaurants, Hispanic stores, and making sure that all the information was there and was in Spanish, and had volunteer translators So I think it was a good community effort that really paid off.
Have we learned anything new since we last spoke about long-term effects from the virus?
Not that I'm aware of. I think that's going to come more as we go forward. I think maybe last time we talked about the underlying cardiac issues in terms of, and as opposed to most respiratory viruses, they don't really affect the heart, but we're seeing a number of cases where you have myocarditis, which is pretty rare viral infection of the heart muscle, and that it doesn't really show up initially, but even young athletes have to be real cautious if they've had the coronavirus, that they could have had some heart issues, and then they don't really find out about it until they try to go back to their normal activities, and it can lead to a bad outcome.
And I did receive another email in advance from a Hot Springs Village resident asking if you could talk about the state of the virus there.
Well, you know, it's been kind of concerning over our numbers over the last 3 or 4 weeks, because you know, the numbers that I have access to is just, you know, for the Garland County portion of Hot Springs Village, and we were only seeing, you know, 3, 4, 5 cases, you know, that of people that were either positive or under investigation from the Hot Springs Village. But over the last 3 or 4 weeks, we've seen a pretty significant increase, up to 20, 25 people in that group. So it's something that I'm keeping an eye on and trying to make people aware that there's definitely you know, COVID-19 virus in Hot Springs Village, and I think a lot of people there have been taking you know, extra precautions, but I think they really need to double down on it because there's virus in that community for sure.
Has the local contact tracing shown a trend in any kind of clustering or certain types of activities people are engaging in?
Not that I'm aware of from the reports that I get from the state. Ours is, with the exception of the outbreaks in the nursing homes, our spread has been really community-wide, even you know, even a geographic distribution. You know, I kind of look at that around the county, and you know, we've had kind of groupings in Piercy. We for a while we had a number of cases in Royal. Over the last few weeks, we've seen a kind of an increase in Lonsdale. We didn't really have any cases in Lonsdale for months, and then 2 weeks ago we had 5, and then this past week we had nine of our cases were in Lonsdale. So you know, I think it's pretty well spread around the county. Sometimes we do get some little peaks, especially when you know, you get you know, one family gathering that causes a lot of spread.
Speaking of family gatherings, I know a lot of people did sacrifice seeing their families for Thanksgiving in order to protect them, but given the amount of airline travel and spread we've seen since then, it's pretty clear a lot of people did not comply with that advice. So Christmas and other holidays are reasons to get together and are coming up. What do people need to do to stay safe?
I think follow the recommendations. Don't be in large groups. I mean, I think the recommendation for Christmas is going to be the same as Thanksgiving. Try to limit any family gatherings to 10 or less. Continue the social distancing, the mask. I think we even talked about if you were going to have a group for Thanksgiving, and do it outside if you can. If you can't, open the windows and turn on the heat, and just you know, realize that there's somebody in your group that could have the virus, and it's highly contagious, and you may come away with it. So you just have to be really smart about you know, knowing what your environment is. Right.
As morbid as this is, it may be better to not see your family right now so that you're still around to see them next year.
Oh, definitely. I think a lot of people are taking that attitude.
All right, well, the Governor Hutchinson is about to come on PBS in 5 minutes to give us an update seemingly on the vaccine. So I'm going to let you get the final word in here, Dr. Shelby, and I'll be seeing you again for this update on January 7th.
Okay, well, I appreciate you, Paul, for having this forum. I think that the more information that we get out to the citizens of Garland County, the better off we are. I think making sure that people understand the seriousness of this to individual families, individual people, and to the community as a whole, and that this is going to be with us for a while. The vaccine is not going to make it go away overnight. I think that it will make a significant decrease in number of cases at some point. Again, we might be looking at 3, 4, 5 months down the road until we've got a higher percentage of people that are vaccinated. And I think it's people just need to keep educated. I can't emphasize enough that we all want people to get the vaccines. Vaccines you may have some symptoms from it, but that shouldn't discourage you from getting the vaccine. And just, I think one of the things that we've tried to do from our task force to other groups in the community and our leadership is how important to doing the simple things and smart things. And we will get through this, and things will be better. But we've got to all work together to make that happen.
All right. Thank you, and have a good evening, everyone.